Welcome back. It's great to see you all getting involved in what the platform has to offer. All the content from today will be available to view on demand within 24 to 48 hours, so don't worry if you've missed anything earlier. Let's start our afternoon with a discussion focusing on technology enables workforce. The need to increase efficiencies within the healthcare system is more crucial than ever before, as the demand on services has seen significant increase over the past 18 months. New technologies and software are needed to assist in the implementation of efficiency in areas where huge amounts of data are available, such as workforce planning. Across teams such as HR, finance, operations, and project management, these new technologies and softwares can introduce new ways of working, which mean tasks are accomplished faster and more accurately, whilst reducing stress, waste, and costs. It's also important when looking to undergo digital transformation that the staff can properly use these technologies and aren't left behind in a digital skill gap. This is also true when we look to digitally equip frontline workers with the correct digital tools. The technology is only beneficial when used properly. And when it's used to its full potential, following training, we see enhanced task management, reduced mental health burden, and improved staff retention, and ultimately improved patient care. So to explore the topic, I'm delighted this afternoon to be joined by Andy Dylag, Corporate Sales Manager, Epos, Tracey, Eyre, RN, Programme Lead, Digital Readiness, Nursing, Health Education, England, Neville Young, Director of Enterprise and Innovation, Yorkshire and Humber Academic Health Science Work, Lee Rickles, CIO, Humber NHS Foundation Trust, and Max Hodges, Chief Clinical Information Officer, the Dudley Group Foundation Trust. Now, don't forget, if you've got a question, don't be shy. Please use our live Q&A function. You'll find that at the side of your screen. I've just realised, Andy, did I get your company name right? I did, Epos.
You
I
absolutely did.
Highly unprofessional of me. I should have actually came on, but let's kick off with you if we can, Andy, and welcome to all of
Thank
you.
you.
How can the healthcare system optimize new technologies and software to drive efficiencies? And particularly, I'm thinking in the areas where huge amounts of data are available, as we said in the introduction with workforce planning.
So we know that the healthcare system in the UK is consistently under scrutiny. Institutions are dealing with budget cuts whilst having to improve patient care, reduce waiting times, and in general work more efficiently at the same time. And with the shift to hybrid working, we're seeing more and more software vendors beginning to add sophisticated analytics that shine a light on broader organizational working patterns and trends. So essentially, organizations are trying to think about the employee experience more broadly, going just beyond business enablement and identify areas of improvement. So from an audio solution perspective at Epos, we've introduced Epos Manager, which is effectively a free management tool. It allows IT administrators to update, manage, and track their headset state to ensure maximum productivity across a trust, a group of hospitals, GP surgeries, what have you. Epos Manager also enables organizations to analyze the use of their own equipment and gather insights on how their employees can work smarter. And by employing unified collaboration tools, healthcare workers can share data insights, research, and ultimately improve patient services across the board.
Fantastic. That's a good way to set the scene for us. We'll dig a bit deeper into what you're actually doing and what the uptake's been like a little bit later, Andy. But Max, Dudley's considered one of the most digitally advanced trusts in the country. What's your digital journey, if you like, been like?
Well, it's been a steep learning curve, I think, as it has for many trusts across the country. I think over the course of the last 4 years, we've been on a major process of procuring, implementing, embedding a modern EPR and other digital communication platforms. And that's required a lot of support for our workforce to embrace digital systems, digital processes, which, as we were saying earlier, it's a bit of a challenge for many of our more senior clinicians. COVID, of course, has then really catalyzed everything. It provided lots of challenges, but I think it also took the brakes off too. We're now having conferences on digital platforms like this, using Teams and other communication systems like that a lot more. But it also opened the eyes of our clinical workforce to how they could use digital EPR systems, especially in a high threat infection control environment that COVID presented with us, not having patient notes lying around, being able to communicate more easily with other parts of the hospital really made a big difference. So we've come a long way, and we've applied those lessons learned through, and as we now sort of emerge from, hopefully, into the post-COVID era.
Hopefully, yes. I noticed Lee was nodding away there. Lee, how does a workforce become digital, and do or should they realise they're digital?
Well, that's a really good point, Helen. Realistically, digital should just be part of the job. Everybody does digital. Outside of in our normal lives, we will use telephones, we will use smart devices, we will do online shopping. But when we come to the workspace and we look at how employees and staff work in an environment, we can overly complicate, make things too difficult. And we also have other things around compliance and standard and guidelines that to some degree can move very slick digital processes to a little bit more complicated. So I'd say we need a digital workforce. We already have a digital workforce. The issue is are we giving the right people the right skills at the right time? So are we trying to train everybody and develop them all the same speed and all at the same pace? Or have we got examples where we've got like the Digital Academy to train and develop leaders, but there's also the bit of getting the basics right. So where do we pick that up on training of admin or clinical staff when they enter the organisation, when they're in the organisation? How do we make sure they are confident? How do they get that competency rather than training and development? How they feel they're more than empowered to do what they need to do? And I think when we're talking digitization, what we're really talking about is confidence, and there's a benefit in there. If it's easy to use and it works well, things like training are minimal. I think the challenge we have in the health sector is our systems generally are very old fashioned, that they're not based on modern tech of how you would interact. My teenagers would probably struggle that it's not done in the same way that you only use two thumbs, and it doesn't work on a smartphone. It's quite archaic. So I think have we got a digital workforce? Yes. Are we always getting the right approach to digital workforce, or are we treating them all the same? I think there's a challenge to ourselves that I think sometimes we just group people too much together rather than seeing the benefit of that difference or how we work differently. And our tools don't help us to some degree, but that's the challenge we've got to do, because we've got to make it so these tools that we use digitally are so easy. You don't really need a great deal of training. That's unfortunately not the situation we're in at the moment in health, I'm afraid.
Yeah, no, I think you're probably right there. And sometimes when we have these conferences, digital skills and skills gap form whole half-hour panel discussions. It's not what we're focused on today, but very, very valid points there. Tracey, tell us a bit about what you're doing in your national role.
Readiness team. I also report into Natasha Phillips, Chief Nursing Information Officer for England. So it's a definite partnership. So digital readiness team is all about digital learning, development, as you've mentioned, structured, easy access for all. It's about that board and senior leader development, but it's ward to board. It isn't just about the senior leaders. Yes, we've got to get the right moods there. We've got to get the right climate, but we've got to make sure that everybody is equipped to do what they need to do. So the work that I'm doing is focused on the professionalization of digital nurses. So for me, there's a spectrum. You've got the digitally enabled nurse who uses technology to deliver safe and effective patient care. And you've got the nurse who chooses to work as a specialist, as I did pre this role when I was in an acute trust. The lower focus of what I'm doing is we're starting at the top with a CNIO masterclass. I'm looking at commissioning an MSc in nursing informatics. Now, we need to have digital running through all education. For me, it's a golden thread. And if we start with the masters, it then becomes easy to draw elements out and move it back into undergraduate. So I guess the work that I'm doing is making sure that the role and the skills that the nurse brings to the digital world is recognized and utilized to its ability. Systems are all about how we use them. It shouldn't be something that's done to us. It should be something that we're part of. And I guess the biggest force is looking at as you've mentioned, the skills, the capabilities, the competencies that are needed to make sure that we give that nursing workforce the tools that they need to be able to do their job and deliver the care in the way that we want them to.
And just while you're on that point, Tracey, I mean, how does that fit in with the ongoing work on blended learning, AI, technology enhanced learning?
Yeah, so I don't think it'll come as a surprise to anybody. There's over 680,000 nurses currently on the NMC register. That doesn't include midwives and nursing associates. So all of those elements are really important to nursing. So we know that we've got a shortfall in nurses. We've had this great investment. We're going to improve services. We're going to build new hospitals, but we've got to make sure that we've got the workforce to deliver the care within those hospitals. The blended learning degree now, the nursing one, allows students who are unable to go down that traditional student route of university. It allows them to study at times and do their clinical commitments at times that they can around their own personal commitments. So we're opening education up to people in a way that we've not been able to do before. I know I'm here talking about nursing, but I know there was one launched a couple of weeks ago for medics as well. And I think it's really important that we give everybody the opportunity to be involved. And I don't think I'm out of focus by saying I think COVID's done that. I think people have realised that it's a profession and it's a valuable profession. And maybe people that weren't interested previously now are focusing. The AI element is really important. For nurses, it's about contextualising. So as a nurse previously, when I thought about AI and robotics, I was thinking it's the impressive Da Vinci robots in theatres. But for nurses, AI technology is that decision support that they'll get. So if they've got electronic vital signs, they'll get an electronic news score, which will then give them guidance on what to do. So it's about that context. It's about thinking of how they're using it currently and making it real, because I think nurses we underestimate the knowledge that we have, and sometimes that's because we don't know what it's officially called, for want of a better way of putting it. It's things that we do every day, it's things that we use every day, but we don't actually recognize. We just see it as something that we do. So I think it's about that recognition of the skills that you have in the role, but also that context of how you're using it in your everyday life as well as your professional life.
Lee mentioned confidence, Neville. I'm sorry that you're the last person I've come to, sitting very patiently waiting there. How do we empower staff, do you think, to use digital with confidence?
Well, I think Tracey's points and Lee's points are really good about, the sort of formal training route that we need to go down to build competencies. But I think if I think about the HSN's role during and after the pandemic around helping roll out technology into the NHS, whether it was digital first primary care or remote management of patients, where things worked really well was where staff were empowered to use digital, but also feedback positively or negatively, and in effect help with the design of the implementation of a digital service into their everyday working lives as well. No digital solution is lifted and shifted identically from one organization to another. But if we work with our staff, we can see from the pandemic that they are good at this. If we engage them and are willing to learn from them as innovators, then we get better utilizations of product, and actually products get turned off that don't work, which is really important as well. So I think there's something there about utilizing the skills that are already there in our workforce, as Tracey alluded to. We have got a highly skilled workforce. They are digital already. If we engage with them, then I think we can really get the implementation right. And then I think it's the digital world, innovators and apps. It's all about it's the return on investment for the number of clicks that you put in. That's what drives products off the hands. It's the same for health. It has to be simple. It has to work well. You need to get more out than you put in almost. And I think if we work with the staff at the design phase and the implementation phase, then we will empower staff to use digital more, because they'll feel more involved in its development and its use and its implementation. So for me, empowering the staff to be part of the solution, part of the implementation, they're the feedback loop. that's a key thing for the engagement, I think, around digital. And I think if we do that well, then we'll have a digitally empowered workforce who want to learn and do more in that space.
Just one level there, that empowering the staff, and also what kind of solutions from your work that you've been doing have you discovered that healthcare workers really need?
Enable technology without compromising sensitive information or data. I know it's a massive concern in the healthcare sector. My wife is an NHS worker, and at the start of the pandemic, there was absolutely, wide open calls on a laptop. I could hear everything that was going on with her calls, and very quickly she identified, I need a headset. You absolutely cannot hear some of this information which is going on. So when it comes to selecting devices for healthcare workers, certain features are particularly important, such as ultra noise cancelling microphones, active noise cancelling, long battery life for wireless headsets and things like that as well. But also a lightweight device, so it can be worn all day. As Tracey mentioned, there's a shortfall of nurses at the moment, and by working digitally, they can actually get more appointments done. But they need devices which can help them do that. And there's no point lumbering them with a really, really heavy device, which they might find uncomfortable or anything like that. So security is also a big concern as well. Again, making sure that patient information is kept within the NHS and between the patient and their nurse or doctor or anything like that. So with our wireless headsets, we actually build in technology to make sure that they are unhackable, so to speak.
Very important. Max, I'm just wondering if you've got some examples that you can share from us of the benefits from implementing digital solutions, possibly around the maternity area. I think that's an area that you've looked at.
Yeah, so I think there's benefits to patient, staff, and organisation in that order of importance. Even I think Tracey touched on things like vital signs monitoring, electronic observations, and then clinical decision support that we can build in to help them with escalations when patients deteriorate. You mentioned maternity. We've recently put in our maternity EPR solution using Allscripts Sunrise product, which I think is actually the first in the UK to actually implement it in maternity. And we've already started to see a range of benefits, both from patients in terms of access through a patient portal to their records, so they don't have to carry big, bulky sets of maternity notes around anymore, risk losing them, etc. It's easy. They can travel around the country and still access them easily. If they were to present to another hospital, they can still access them online. We've been able to start to streamline our antenatal services. We'd be able to start to have a better view of what work has been done by the organisation, so that we can actually make sure that we are recording all of that activity and noting it down. There's a huge benefits that come from digitisation, but it has to be borne in mind that you always shine a spotlight on your services when you do that. And usually the data always gets worse before it gets better, because actually you're seeing what the true picture is that's been hidden behind those analog paper processes which papered over the cracks.
Thank you for that, Max. I'm just keeping an eye on the questions coming in. Annie says that empowering staff is absolutely the key. Totally agree with the panel. What current issues exist around inclusion and diversity for clinical staff groups, and how we develop and deliver a digital strategy that is digitally inclusive for staff and patients? Lee, is that anything you can tackle?
So yeah, I'm more than happy to pick that one up. I think the point is in the question, really. The only way you can deal with inclusion and make sure it's led is patients, carers, and staff are fully involved and empowered and engaged. And that's from the point of view of what is it important to staff? What staff and frontline workforce, which we have a shortage. There's we've got a massive skill gap. If that works for them and that's slick and effective, then that makes their lives easier. They might even enjoy using the technologies and the systems. I know that might be a bit of a shock, but I think the key bit is actually involving the people right at the beginning. They're the important people. A lot of the technical people, the digital people, are there to solve a problem. So I think the answer is in the question. You just pull people together. You empower them and you give them that responsibility and that leadership. It's just not it's not just doing it for the sake of it. It's meaningful, and that's the important bit. And that is immaterial whether it's an admin person or it's your chief nurse. All of them have a key role. And I would probably say from a lot of digital empowerment, there's a different view. If you're looking at an EPR, I don't want the chief nurse's view of it. I want the admin and the clinicians of the junior doctor's view who are actually using the systems. So, for example, I know from a GP practice perspective, GPs only use 80% of the system. Everybody else uses the 20%, sorry, and everybody uses 80%. So if you're really looking at optimization, you've got to look at the people who are actually using it. Otherwise, you do end up in them workarounds, official, unofficial, and people get frustrated. So yeah, I think it's a good question, and I think it's the thing we should be doing anyway to be absolutely, especially that patient and carer. It's so important we forget them, that they're the only reason we're here, and they have to be part of that conversation, part of that journey. To some degree, we're talking digital workforce. They're part of our workforce. That carer looking after that patient is effectively part of our caring workforce, potentially unpaid. They're another group that we need to support. Probably another webinar, I would guess. But
you're volunteering your services for the next panel. Aishu says, how would one share experiences in NHS when trusts have invested in IT technology and got it wrong? One is unlikely to publish it, and if one attempted, journals are unlikely to accept it. These technologies are mega expensive in a climate of limited financial resources. Is that anything you can take on, Tracey? You know, how do we know when things aren't working properly? Because people perhaps are reluctant, aren't they, to share things that haven't worked out?
I think they are, but I think that's a barrier that we have to break, because if we don't share what's failed, we're passing that on to someone else. I think it's really important that we share both our successes and our failures. Without one, you can't inform the other. I think from a clinical perspective, I think we're very vocal. I think IT departments and transformational departments find out quite early if things aren't working, because you will see that there'll be an impact on patient care, there'll be an impact on patient flow, there'll be an impact on staff, and you can actually see the activity on your systems. And then I think it's everything that the panel said. If we become a whole and we stop worrying about how we're perceived, we can share the learning, we can make improvements, and we can collaborate. And I think if we don't collaborate and share that learning, we're already setting ourselves up to fail. So I think it's incredibly important that we do it. And I think publicizing it isn't a bad thing. I think somebody who can say, I don't know something, but I'll ask and I'll find out what happens next, is one of the most powerful people that you can have on your side. I think without that, we're just setting ourselves up for failure.
I think as well, we learn from failures. And I think the beauty of getting healthcare professionals in an environment like this together is that you can talk about your wins and things that haven't worked out and learn from each other. And just before we leave you for a second, Tracey, you talked about all these incredible new courses that are available to nurses. How do nurses know what skills they need and what education opportunities are out there to equip them well for the next decade in healthcare?
So I think from a nursing perspective, we're very competency and capability driven. It's how we work. It's how we prove that we're fit to stay on the register. So I think what we have to do is understand what the baseline skills of the workforce are. We make an assumption that newly qualified nurses are digitally literate because they're using social media, they've written assignments. But actually, I think it was alluded to before that using a system can be very different. It doesn't look like the things that they expect. Everybody asks why doesn't it look like Apple? So I think there's something about we have to define what our baseline is. That works starting with the HEE digital self-literacy assessment tool. I think it's being launched in April of next year. And that allows the individual to self-assess themselves on a scale of 1 to 11. And depending on your results, the AI in the background will then offer you opportunities of learning at the end.
Wow.
And again, some of it's about contextualizing. So, for instance, what does data mean? So, having spoken to nurses, they often see that is like a quality target, or it's a patient target, or it's a performance target, when in fact the first piece of data that a nurse gets is a patient name. So again, it's about making it real in that clinical world. The Faculty of Clinical Informatics has published a competency framework. HEE have done a capability framework, so that's a great place to start if it's something that's new to you. But the outcome of the work that HEE are doing in partnership with the CNIO office at NHSX is going to result in a digital nurse career framework. So the idea of that is that as a nurse, you can look at yourself on a scale, whether you're digitally enabled, delivering care, through to wanting to specialize as a nurse informatician. You can see it and you can self-assess, and you can see at any point where you are on the scale. Opportunities of learning will be provided that will allow you to then move up the framework. So I guess the outcome of that is that digital nursing, and I'm passionate about that because that's what I did for 10 years before this role, is that it's a specialism seen in the same way as other clinical specialisms like palliative care, oncology, and diabetes. Because as long as we're continuing to use electronic patient records, we're developing at that pace. The nursing element and the clinical element is the conduit between IT and the front floor. It's that translation that makes sure that the subject matter experts in the IT department, the developers, match up and link through to what's actually needed. And again, it's that context of what it does, what it means. I think sometimes the other element, and I'm going a little bit off piste here, sometimes the other element I think is that when you talk to IT staff and you ask them, do they have an impact on patients? A lot of them will say no. And I think we have to flip that on its head as well and say everything that they do affects a patient because they're enabling safe and effective patient care. Sorry, that's another passion of mine.
No, don't
sorry
worry.
for going off piste. I think it's all about that learning and understanding that we need fundamental skills, but we use our subject matter experts and ensure that they understand at the end of it, this is why you're doing it, because you are making a difference.
Well, you've led me quite nicely to Neville, because I was going to talk to Neville about, do we develop digital health specialists? Tracey talked about digital nurses. Could we have digital physios? Could we have people who have that specialty in the digital world?
I think absolutely. I mean, Lee alluded to it a little bit in his piece as well, that we're all digital now. But I think that depth of knowledge that you can build up in a particular specialism is really, really important. I think what Tracey was alluding to there is you really never want to see a health solution designed by the people in IT on their own. You never want to see a digital solution designed by the clinicians on their own either, for that matter. But when we can bring them together and get their skills mixed appropriately, and speaking the same language, importantly, which is about those skills and competencies, that's when we start to see really good, innovative solutions that actually work, that stick, that everybody co-produces. So the people in IT have some ownership over the co-production of something that benefits patients because they've co-produced it with the specialists in the healthcare system, whether they be nurses, physiotherapists, OTs, it doesn't really matter, but they all need to be able to speak that language, I think. And I think that's where we're getting to in terms of a digital workforce. And yes, leadership in those areas, whether they're physio, etc., is really important. And people who can champion those relationships in an organization are really important, because that gets into the culture piece as well. Once we have leadership, at the top and at the bottom of an organization about the digital agenda, that's, I think, when we see the real impact, on the front line. And I think I think certainly my feeling is the panel would generally be supportive of that, and I hope the audience would be as well.
I'm sure they would. And Andy, we've just got a few seconds left, but you've talked about the importance of audio communication tools for healthcare workers. Listening to what the panel have said and their roles in the clinical world, I suppose that collaboration is really important, isn't it, for the innovative solutions that you come up with?
And collaboration tools can lead to better patient services, whether that's between healthcare practitioner to patient or between healthcare practitioners that we're on this panel with today. it's all about gaining confidence and improved patient outcomes. According to our research, 66% of respondents working in healthcare say that high quality audio equipment is indispensable to their performance, especially now in this post-pandemic world where we've got kind of hybrid working styles, if you like. We're doing GP surgeries online over Skype or Teams or whatever platform a surgery might choose. So we've found that 83% of global decision makers think that audio equipment has become more important over the last 18 months, 2 years, absolutely. And what's apparent is that smart investments in technology solutions and equipment carries a degree of future proofing as well. I think, like Neville said, in terms of getting these systems built with clinicians, but also with the infrastructure staff as well, and making sure that it fits the workforce, but also making sure that people have got the right tools for them too.
Well, we're going to end with you, Max. I know your wife's a GP and she's busy doing her surgery on the phone at the minute, but I just wondered if you could leave us just with a word of advice, really, to other trusts who are taking on similar projects and embarking on the kind of journey that you've been on. What would be your sort of top tips or word of advice?
I think Lee and Neville have picked out my biggest one, which was to get clinical engagement and subject matter expert involvement from the staff who are using the systems, both to own and drive forward the product, but also to assist with the design. And IT can assist by interpreting and managing expectations of what a system can do, and try and limit their expectations when they shoot for the sky and perhaps try to bite off too big a piece of the cow at a time. But definitely having clinicians involved from the start is absolutely key. And then I think the other thing I would say is have a good governance structure, debate around it, because with limited resources, there has to be a degree of prioritization, and having a good, transparent prioritization approach is key to delivering the best with what we have in terms of resource to help our patients and keep them safe.
Do you know, I knew that panel would go really quickly, and it was lovely to see your passion coming through, and particularly yours, Tracey, on the nursing front. Keep up the good work. Thank you so much. Thank you to all my panelists for a fourth and really interesting debate of the day. I hope you find that as useful and fascinating as I did, because as much as we strive to look after the patients, we must also look after the ones who look after them. Let's take our final break of the day with one last panel to come. A reminder, we've got a great prize and rewarding prize for those fully taking advantage of community building. Those in first, second and third places will get to donate in their name to the Magic Breakfast or More Trees. So please take advantage of this during the last break of the day. I will see you shortly.